All right. Hello, hello. Good evening, everybody. Um, my name is Caryn Gill. I'm a licensed professional counselor here with no CD, and I've been working with people with OCD and anxiety for a few years now. Um, I'm just here to hopefully answer some questions, help people in whatever way I can. And so I guess we can start. So, first question, um, and it says, "Is ERP therapy as scary as it sounds? And what are the support groups like? Are they something I should try?" So let's do one question at a time here. So, is ERP therapy as scary as it sounds? Um, I mean, I guess that could be a little subjective. I think sometimes people it really also depends on like where you are in treatment. But I will always say, like, I think sometimes it has the reputation, ERP can have the reputation as being like um, kind of insensitive or cold or cruel. And I think, as somebody who once had that, misunderstanding of it and now does it for a living, I think that nothing could be further from the truth. I love the whole idea of collaborating with my members, collaborating with the people I'm working with, and figuring out a way to make it approachable and taking a gradual approach. Sometimes life doesn't let you go gradual. Sometimes life will just present you with like your level 10 out of 10 fears. In that case, like that's what your therapist is there to help you with and help you work through. It's scary, it's difficult, but I think it's worth it in that sense. Because it's sort of to me, it's sort of like going to the gym and trying to get strong, by building up muscles, right? You kind of have to tear down the muscle so that gets when it repairs itself, it builds its back stronger. And that sort of ERP is scary, but I think like most good things in life, um, good things tend to feel risky, right? And so, in terms of support groups, I'm not sure like what other people's support groups are like, but I know like for the ones that I lead, they're really, lack of a better word, supportive. Sometimes, I barely talk because I'm just there to kind of moderate and hold the space. But it's people with all, different types of OCD, different stages of treatment. We also have ones really specific for specific types of OCD, or ones for parents of people with OCD, or loved ones of people with OCD. They're free, so you can always try it. We're really open to feedback and everything like that too. So, all right, good. So we have some other questions here. Let's see. All right. So this one is, hello. Why do the thoughts and feelings feel so real sometimes? Um, I think because, if you think about what our brains are capable of, what they're responsible for, it's almost like it doesn't necessarily matter if they are real or rational. Like OCD doesn't care what's real and what's rational. It can feel really real because it's about things that are really important to you. The risks can feel really real. And so I think like rather than if you struggle with things that feel really real, also remind yourself that sometimes feelings can be false, like, or not false, but like feelings can be not an accurate reflection of what's going on. So say for example, like if you think that you are having a heart attack because you're actually having a panic attack, um, a lot of that is like false alarms, right? If there's a fire alarm that's going on, but it's really just a fire drill, you kind of but you don't know, you might think that there's actually a fire. And so the same thing is true for our brains, right? So our brain doesn't really know. And so it's up to us to give it that opportunity to practice feeling afraid. And so that it can like kind of learn a new response to that fear. So good question. Okay, let's see. Okay, so what do you think is the best type of treatment for dermatillomania, also known as skin picking, skin excoriation disorder? Yeah, so We use habit reversal training here at OCD. Habit reversal training is sort of like like a family member of exposure and response prevention. It's similar in some ways in the fact that it relies on really examining the behaviors, sort of like the before, during, and after of those behaviors, and really addressing behavior change before really. Like enacting change through change of behavior, change in environment, change in kind of coming up with like alternate or competing responses. And so, yeah, that's usually what we use here at NoCD and what is often used to treat skin picking. Um, so, okay, let's see. All right, so I'm scared to write or talk about my OCD because I'm scared that my thoughts will come true. All right, so some good, very, very common, magical thinking fear. A lot of people fear, like, just that if you're thinking about something or talking about it, like saying it out loud, will kind of make it a reality. How can I get through that? I mean, not to like it's very straightforward, not to say that it's easy. But for exposure and response prevention, the whole idea is to slowly approach saying and writing those fears. So obviously you can take a stepwise, gradual fashion if it means, say for example, there's certain words that are really triggering. You can like use those letters in those words in different words, right? If that's kind of where you need to start. Sometimes people feel like it's easier to look at those words if somebody else is writing it. And so if that's where you need to start, then you can start there, right? Either way, it's all about taking those steps towards rather than away. Because any step that you take towards facing that fear will eventually help weaken that fear, and give you some more freedom from it. Um, okay, so let's see. Okay. Existential OCD. So this question is from John. It says, what are your tips on dealing with existential OCD? So existential OCD is, it can be tricky because there's not really that opportunity for like disconfirmation, maybe the way there is for other more like tangible types of OCD. When it comes to like disconfirmation with this more like abstract kind of obsession, it could be more like demonstrating to yourself that you can handle it. You can like tolerate not having the answers. I think obviously like true for any like all types of OCD, but especially existential, really suss out if you're doing any sort of mental compulsions. Often with existential, it can feel like you're obsessing when what you might be doing is ruminating. And so really figuring out like, okay, what am I engaging in right now? Am I having intrusive thoughts or am I engaging in some sort of mental compulsion? And especially for existential OCD, sometimes I think like it can take people away from the moment, ironically. And so really like combating that need to examine reality by engaging in reality, engaging in things that are important to you, things that maybe OCD has pulled you away from. And so really identifying, okay, what can I be doing with all of this mental energy? Instead of trying to figure it out, what else can I do right now that will actually give to my life rather than take away from it? Okay, and this is a two-part question. So, are there any physiological effects from OCD and anxiety that may be surprising to some? Um, I mean, I think anxiety can make people experience physical symptoms, sort of like generalized anxiety disorder. One of the hallmarks is experiencing physical symptoms of anxiety. Um, I know, like sometimes people with OCD can experience like symptoms of panic or like, difficulty sleeping, feeling on edge, and like stomach aches, and all of those, like that kind of muscle tension that is so true for other types of anxiety disorders too. Um, and so, I mean, I think like anything that, like, I think there's such a big mind body connection sometimes that I don't know if it's surprising, but I think it makes sense, right? Given the fact that OCD can make people experience so much prolonged distress sometimes. Um, so, okay, let's see. Mm, okay, whoops. Where did it go? Okay. Um, this is not a question, but I think it's beautiful. I think the ERP or the OCD community is just really special in the fact that it's so supportive. So yeah, it says, hello, everyone, stay positive. I struggle with ERP as well. Keep your heads up. Yeah. So I echo that. I echo that sentiment for sure. Okay, let's keep it going. All right. This is from Jen. Is it normal to feel like you have it worse than others with OCD, or that your OCD is more complicated than others and therefore can't be helped? Yeah, I mean, it's the funny thing about this feeling, the feeling like my OCD is sort of like the exception to the norm. Is that it's actually really common. And so whenever people are expressing, well, like, I don't know if you've ever dealt with this kind of OCD, or I don't know if I can be helped, right? There are people that really struggle to make progress with ERP sometimes, right? I think that, like, when it comes to those cases, sometimes it's really important to look at maybe if there's other like treatment interfering behaviors, if there's other circumstances or other co-occurring experiences that can be complicating it. But for the good portion of people, ERP is going to work, right? It doesn't necessarily matter like how weird or unusual your obsessions are. I was just telling the people in my support group this, but I think it's helpful to remind yourself that even if it's like a even if it's a subtype or a presentation that there's not that much information on, if it follows like the pattern, that OCD pattern of, having a lot of intrusive, unwanted, recurrent thoughts, images, urges, doubts, feelings that cause distress, followed by some sort of behavior or mental process to try to prevent, um, do away with, right? Neutralize that distress or that feeling, that anxiety, and that if it's taking up time, and like the fact that it is, you know, kind of a process that you enter into, right? I think if you have those ingredients, no matter how unusual it is, or however rare it might sound or bizarre it might sound to you, ERP is the answer for that. So, I mean, I think, like, trusting the process. I know that sounds like kind of cliche, but really allowing yourself to just do the thing that has been shown to work. So, and taking it moment by moment too, I think, is helpful. Whenever you have thoughts that are like like kind of catastrophic in that nature, like acknowledging that you have those fears and like talking to your therapist about it, and then doing the work, right, as planned. So, all right. So let's see. Let's just moving right along. Great questions tonight. Okay, so what is pure obsession? Um, I'm gonna guess that you mean like pure O. So pure O is a term that was created, I want to say, in like the late 80s, early 90s, kind of when OCD and ERP were not as well known as it is today. And it was made by, I want to say, Dr. Stephen Phillipson. During, like, when he was working with people who were presenting with presentations of OCD that were kind of outside of what was typically known. So, for example, like at the time, it was like contamination, responsibility OCD, like the hit and run and like the stove, like the door checking. That was a little bit more I guess, well known among mental health professionals. And so he kind of, I think, used that term because it helped his patients give a name to what they were experiencing. And so pure O it can be a little misleading because people with pure O also engage in compulsions and they might just be mental. And so they still have those like that obsessive and compulsive element. But I think it was really an important term for people at the time to really feel like they had a place in the OCD community and to feel like they that they could be helped by ERP. So that's my understanding of the history of the term Puro. But again, it's another form of OCD, which means there are obsessions and there are compulsions, and that it could be helped with ERP. So hopefully that helps. That's a helpful explanation. Um, let's see. There are some questions here about medications. So what are some of the safest medications for OCD? Obviously, I'm not a doctor, so I'm not really actually going to answer this question because I don't, I'm not really able to answer it. I don't really know the answers to that. But if you have any questions about medications, I know that the IOCDF, so IOCDF.org, they have a few articles and information pages on medications, and obviously like talk to your doctor about that, because obviously that's it could be different for everybody based on your own health, based on your own kind of brain chemistry and everything like that. But yeah, the IOCDF has good information on medications as well. Okay, so let's see. Okay. So can OCD alternate something I did in the past? I remember it as one thing, but after my condition got worse, I now remember it as something else, and I worry a lot about it. A lot of doubt. Yes. So OCD is, commonly referred to as the doubting disorder, the doubting disease. The irony about checking, right, including mental checking or like, trying to remember something, is that the more you do it, the less sure you get. And so think about it. Like we're going to do like a little thought experiment here. If I were to tell you to remember a set of numbers, right? Um, and and then I asked you 30 seconds later to repeat them, right? And if I kept asking you, are you sure? Are you sure those are the numbers? How do you know those are the numbers? Are you sure? Right? If I kept asking you that, after like this first minute, you'd be like, actually, I don't know. Right? But that first time I asked you what those questions or what those numbers were, you probably felt pretty confident. And so it's the same thing with trying to remember an event, trying to remember your actions, right? Did I lock the door? I don't know. Did I do something in the past that was hurtful? I don't know. Did I do this? Did I do that? The more you try to remember, the less sure you'll feel, right? And the more you'll doubt. And so the irony, right, is that in order to kind of feel more sure, you kind of have to trust that you're never going to know for sure, right? And so recognize that OCD wants you to be able to time travel. And that's just not something we can do. And even if you did try and travel, who knows? Your brain might even just say, are you sure you're seeing the right thing? Right. And so rather than trying to achieve the impossible, really giving yourself the chance to take that risk and say, what, I'm not going to figure it out. So I'm not even going to try. Right. I have to trust that this is what happens, right? I have to move on. Obviously easier said than done. That's a process, but any opportunity you can to take that step, I think it's a good one to take. Okay. Okay, so somebody just asked, so how would ERP to help tics work in therapy? I think, like, if you're talking about, like, tic disorder, again, it wouldn't necessarily be ERP, it would probably be more something like habit reversal training, and so, um, habit reversal training or, like, CBIT, I think is another, kind of big, treatment option for people with tics, and so it wouldn't necessarily be ERP. If, however, this is like the difference here now, and this is where functional, like kind of figuring out what the function of it is and how a really good illustration of how everybody's OCD. Sometimes people look like they have the same kind of OCD, but maybe it's really important for the therapists to examine like what is the function of that behavior. If the repetitive behavior is being done to kind of as a compulsion, right? To kind of make sure that something bad doesn't happen, to neutralize a thought or an obsession, then we would do ERP. And that would kind of fall more under like the sometimes like magical thinking or superstitious OCD, with like the Tourettic type of OCD. But Tourette disorder or tic disorder would be like more habit reversal training. So I hope that answered your question. Um, okay, so let's see. So I am happily married, and I went out with some coworkers. I had a really good time with one of my male coworkers, and now my OCD is attacking me, saying that I shouldn't have had a good time with him. Well, first, I'm glad that you were able to go out and have a good time, and experience those fun moments. And I'm sorry that OCD is, attacking it as it tends to do whenever people experience good things, right? I think when it comes to that sense of guilt, right? Like obviously I don't know your experiences. I don't know why that guilt is there or why OCD why you feel like you shouldn't have had a good time. Um, but I think, it's similar to other types of OCD. Notice that OCD is trying to invite you into that process of, making you feel guilty, making you feel like you did something wrong, right? And similar, like I like to tell my members, right? Anytime OCD is kind of like making you feel like you have to, or that you have to not do something, right? Any of the OCD have tos, right? I think is a really good, you could name it, right? OCD is inviting me to do something, or is inviting me to feel something, or inviting me to explore something, or go down this road. And, every time it does that, see if you can practice disengaging from it and saying, nope, I'm going to RSVP no, right? I'm going to not own that feeling that OCD is telling me I have to feel, because I'm not going down that road, So, um, obviously, easier said than done, right? I think that's like the tagline for ERP, right? Easier said than done, but not impossible, right? And so, little by little, you could try that out. Okay, so let's see. Whoops. Whoopsies. Where is it? I lost the thing. Here it is. Okay. Um, okay. So OCD bothers me mostly at night. I always fear that something bad will happen to my loved ones. And it's so bad I feel like I'm suffocating. Well, I'm sorry you're struggling so much. That can be really hard, I would imagine. Um, Especially at night, I think that's a really common time for people to suffer with like increased obsessions. Um, I'm not exactly sure why, but my hypothesis would be that it's because, there's not as much going on. And so it's not like you have other things to do at night, right? Like unless you work night shift or something. But if you don't, right, and you're just trying to relax, try to go to sleep, your brain's like, oh, it's showtime, right? And so that's when it's gonna be like OCD can be a lot louder at night, or whenever your brain is kind of trying to be at rest. In terms of that fear that something bad will happen to your loved ones, again, right? That kind of reminds me of that the question I had addressed earlier in this live, just about how feelings can feel so real, the thoughts can feel so real, and the risk feels really real, right? It can feel like a really big risk not to do any compulsions, to not do something about OCD, to not do what OCD wants you to do. But see if you can, work with your therapist, if you have one, to figure out ways that you can cut back on those compulsions. I always say, like, I think that's like a good place to start, before you intentionally do anything to add to your anxiety. To kind of really identify what kind of rituals am I doing, and see if you can kind of cut back on those. Um, it's going to feel hard, right? Like, if there's other areas of your life where that fears, and maybe it feels a little bit less risky to approach it in those situations, like, you can always start there. But either way, um, you really want to take those positive risks. It's going to feel like, why would I ever do that? But the other option is to kind of continue living like you're suffocating, right? And, as much as possible, taking those risks, or it's going to give you a little bit more breathing room. And so I hope you're able to do that. Um, okay, so let's see. Um, all right. So this person's saying, I have an irrational fear of going deaf, because 4 months ago I put something I wasn't supposed to in my ear, but 5 doctors said I'm fine, yet I still have intense anxiety and worry. Um, I mean, I think, like, when it comes to health anxiety, which is, for all intents and purposes, a form of OCD, it's never going to feel good enough, right? Like, no matter how many doctors you see, no matter how much reassurance you get, no matter how logical you feel like it is, right? You can't really logic or reassure your way out of OCD. Um, and so I think the best thing you can do to move on is to, um, quit the doctor habit, right? You can do to incentivize not going to the doctors, right? Whether it's, I don't know where you live, but I know if I went to 5 doctors, that's a lot of copays, that I would have to pay, right? That's 5 times. Ooh, yeah, that's a lot. That's a lot of money that I would have to pay, especially, I would imagine that they're specialists. So, think about something else, that you could do with that money, something else you could do with that time. Um, if it helps you with, like, response prevention, if you are about to Google or call that doctor, I got this from Dr. Josh Spittelnick's episode on health anxiety on the OCD stories, but he had this really great idea of, like, if you tend to call your doctors, asking for reassurance, if you are already on the phone and they've already answered, just say hello and give them a compliment and then hang up, right? It could be something like that, right? If you, are afraid of going deaf, right? In addition to response prevention, if you have a therapist that you can work with, you can do some exposures to that fear. You can do, different types of exposures to that fear, as in kind of in conjunction. Sorry, I can't talk. In conjunction with, response prevention. Okay. So again, the first step of moving on is to, um, kind of resist those compulsions, right? I think that's a really important first step. Okay, let's see. I don't. Okay, let's see. All right. I don't understand why my harm OCD thoughts don't give me much anxiety. I still don't like these thoughts, and I'm worried I'll act on them. Okay. Right. I mean, I think for some people, they can then start to obsess over, why am I not anxious? Does this mean that I actually really like my harm thoughts? Right. And I think rather than trying to place judgment on your thoughts, um, really just accepting, okay, right, my harm thoughts are what they are. I still have that fear, right? I'm still worried. And so really still continue to address it. The work is really going to be on not placing judgment on your thoughts. Not saying, oh, this is a good thought, this is a bad thought, or I feel the right way, or I don't feel the way I should, right? Rather than, like, shoulding, on yourself and, kind of judging yourself for your feelings. This is true for all types of OCD, right? Rather than evaluating, oh, am I feeling the right way? Am I feeling angry enough? Am I feeling anxious enough? Am I feeling this enough? It's like, no, what is it? What is enough for OCD? It's never going to be enough, right? You're never going to, if it's not, you might never feel like you're anxious enough. And so that's kind of an irrelevant battle to pick, to fight. And so keep doing the ERP. Okay. Okay. Let's see. Okay, let's see. Oh, okay. So loud noises really bother me, and I was wondering if OCD comes with sensory issues. Um, I think, I mean, obviously, I don't know your particular story. I think sometimes people with OCD can feel more sensitive to specific types of sounds. If it's somehow related to a trigger. There is also like something called misophonia, which you could look into and talk to your therapist about. Um, and so, yeah, I would definitely recommend that if you feel like it's really bothering you. Um, okay. Um, okay. I often struggle to differentiate between if my feeling of anxiety is worth it or it is OCD, then which one is compulsion and which one is a normal response. Okay. So I think like if I'm understanding this question, what feeling is like reasonable and what is OCD, and what is a compulsion and which is a reasonable response. I kind of like the idea of like taking a survey method. Right, like, so say for example you're a student and your therapist is like, no, you gotta cut back on those behaviors, those are compulsions. If you're like, but they help me, get good grades, right? It could be helpful to really ask a good number of your peers, how long does it take you to do this, right? What would the process look like for you if you were to do this project, right, this assignment? If their answers really differ from yours, then that might be a sign that maybe what you're doing is, not normal. I don't really like that term, but not necessary, right? In terms of anxiety, I mean, I think that anxiety is a fact of life. There are things that are, there are good things, good aspects to anxiety, and the fact that like it's used, we would not be here if our brains didn't respond to anxiety the way it does. I think it depends on the circumstance, right? I think like if your anxiety response is, um, I think like it's information, right? It's kind of what you do with that information that can kind of make it tip one way or the other. Um, okay, so let's see. Um, okay, so my friend has POCD. How should I support her? Well, you're a really great friend for asking this question, and I'm sure your friend is grateful for you. I mean, I think like just, if really identifying like if there's ways that you are engaging in any sort of accommodation, really like having a conversation with her about like ways that you can cut back and eventually eliminate that accommodation. If she asks you for reassurance, right? Like kind of having that conversation with her by saying, you know what, I know you want me to reassure you that, maybe you're not a terrible person or you're not a pedophile, whatever it is. But because I care for you, I'm not gonna accommodate you. I'm not gonna support your OCD. And just kind of being there for her, being supportive, recognize like having like reminding her that she's somebody with POCD, not necessarily like just she's not POCD itself, right? If that makes any sense. But yeah, I think definitely continuing to, if you are doing any sort of accommodation, reducing and eliminating that, and then also just being there to listen if she's having a hard day, not in like the reassurancy way, but just being her friend, right? I think that's like the best kind of support there. So, um, okay, so Can OCD make you think about a single word on a loop? Yeah. I think there's a, nonviolent intrusive thoughts, nonviolent intrusive images, words. Um, that could certainly be a thing that people think about if it can cause distress. Um, and if you do something that to try to do away with that distress, right? Like I was saying earlier, you kind of meet the necessary ingredients for OCD then. Um, okay, let's see. All right. Why is there a weird feeling still, even after you made progress with your OCD? It's hard to describe it. It makes you feel like the world is off. I'll be going about my day with no anxiety. This is continued. Or compulsions, but that strange feeling will arise and sometimes get me back into the OCD cycle. Um, I mean, I don't know necessarily like why why you might have a weird feeling. I'm not sure if that's kind of residual anxiety, but sometimes again to kind of go back to the what I was saying earlier about judging or analyzing our feelings. Sometimes the whole idea of the strange feeling arising and then kind of pulling you back into the OCD cycle. I would say like next time you have that strange feeling, like treat it with curiosity, right? To kind of pull upon um, the acceptance and commitment therapy world, right? Like be curious about it, right? What is that feeling? What does it feel like physically? What kind of thoughts accompany it? What does it invite? Like what kind of urges do you have because of this weird feeling? And how can you resist doing those behaviors, following through on those urges? Um, I think sometimes anxiety can pop up, right? Even after we've made progress, right? Like the whole extinction burst or that kind of thing, right? Any sort of residual anxiety throughout our day. I also think sometimes if we not to get too like didactic here, but I think if you experience anxiety when you had those obsessions and when you did those compulsions, sometimes our brain is still kind of like, oh, I'm anxious, oh, that must mean I should do my compulsions again. And so it's really just about breaking that cycle. And so I would start with curiosity and definitely resisting any sort of compulsions that come with that. Okay. Okay, let's see. Um, okay, so with OCD, sometimes I do compulsions before I even realize. Um, any tips on dealing with this? It's like my body acts before my mind. I definitely think that one of something that could be helpful is just practicing awareness, right? Like taking some time to start tracking, which sounds kind of tedious, and it could be, but I think that can be helpful. Like be a detective towards yourself. Um, right. I think sometimes people don't realize that they're doing compulsions, and so it can be hard to stop them beforehand. And so sometimes when I work with people who have like a lot of compulsions, whether it's mental or overt, like physical compulsions, I sometimes have them track, like how many times do you do a compulsion? How many times do you have urges to? And so sometimes that very act of tracking can make them more aware because then you have that step in between, right? And so I think that can be helpful. If you still struggle, right? If you're doing a compulsion and you're like, oh no, I'm doing a compulsion, right? I didn't want to, but my body just kind of started doing it, right? Figure out a way to ruin it, which sounds kind of mean, but if you say, for example, I don't know. For example, if you do symmetry compulsions, right, to kind of feel symmetrical on both sides of the body, and they're so slight, like those movements can be so slight that sometimes you don't realize you're doing them. As soon as you do it, do something to feel wrong again. As soon as you catch it, and then I think that can help at least with the whole idea of um, undoing the neutralization. Okay, so let's see. Um, all right. So I'm gonna address this one just because I think it's important to talk about. So has OCD ever pushed people to suicide? Sometimes I'm so scared I might hurt people. I have harm OCD that I want to eliminate myself. I'm really sorry that you're struggling. I'm not sure if you're in treatment right now, if you are able to talk to somebody about this, but I mean, I think like if you're having those thoughts, definitely reaching out to support, to people that you can talk to, whether it's somebody in your family, a friend, a therapist. Um, there's people out there to help you. Whether it's even like the text lines, the hotlines, if you ever feel scared about that kind of stuff. Um, and I mean, I think like often people with these really scary thoughts about harming people, it feels so um something like so it just feels so averse, like opposite to who you are as a person. And so I do want to encourage you to reach out for help if you aren't yet in treatment. And um I think when it comes to harm OCD, um, sometimes like one of those compulsions can be that whole idea of like feeling excessively guilty and recognizing that your harm thoughts are not you. Um, like these are thoughts that are popping up in your mind. There's not like if there's you and then there are thoughts, but right now it just feels like they're one. And so really kind of recognizing that like you don't have to fuse with your thoughts. They aren't, they're not you. Right. And not, this is kind of veering in the side of reassurance. But I think if you haven't received assurance once, then, here it is. Right. I think sometimes when it comes to harm thoughts, thoughts that feel so morally repugnant and wrong to you and against everything that you are as a human being, um, I think it's really important to kind of talk to other people who have these types of thoughts as well. You're not alone in what you're experiencing, and um, there's hope, right? Like you don't have to experience that level of suffering because you have harm OCD. And so definitely reach out for support. And I hope that things get better for you, for sure. Um, okay, let's see. How can you differentiate? Oh, here it is. Let me click on it. How can you differentiate OCD from your real thoughts? Specifically talking about your ROCD. I think that can be, I know I just talked about with harm thoughts, like they're not you, right? All that kind of stuff. I think here's the caveat here. So if you notice that you are constantly trying to figure out, is this ROCD? Is this my real thoughts? Is this ROCD? Do I actually love my partner enough? Do I not? Right? Is that OCD or is that how I really feel? Um, I think then that can become, you could kind of obsess over that. And so when it comes to like that kind of stuff, I would say, okay, like let's take a step back. Either way, the treatment, like the best practices for your mental health, your mental well-being is to practice accepting the uncertainty and doing things that are important to you. Um, being the kind of partner you want to be anyway. So, okay. All right. So I'm going to answer this one. So, what is CBT versus ERP? So, CBT is, I guess I should say, ERP is a form of CBT. It falls under like the CBT umbrella. I kind of like to refer to ERP as like little C, big B, cognitive behavior therapy. It's more like behavioral cognitive therapy, if you will. It's not like a separate thing from CBT. It's just a little bit more specific. So, okay. Mm-mm-mm. Let's see. All right. So, I had a close family member get sick from taking an antibiotic, and it happened over 2 years ago, but the fear of it still sits with me. It was contagious, and my OCD makes me think it could be on everything, everywhere, and that my loved ones will get it again. Um, I just want to move on, but it's so hard. This pandemic hasn't helped. How does one start if they can't get help with a therapist? I wonder if there's a way I can move the thing. Um, but yeah, basically, right, if I'm just reading it through again because I want to make sure I understand what you're saying. Um, so basically, right, if you're afraid, right, about getting sick, because a family member, I'm assuming in your household, also got sick, um, hmm, my loved one will get it again. Oh, I guess if you're afraid that your loved one will get sick again, right? I think it's hard not to worry sometimes, especially when it can kind of cross over into like real life concerns, right? Like in the pandemic. Um, I mean, I think again, right, not to sound like a broken record, but really identifying, okay, like what am I doing? What does OCD tell me I have to do to stay safe? Right? Like really writing out a list of like, what am I doing to try to make sure I'm safe, right? Am I wiping down counters for hours? Am I um, calling them every day, multiple times a day to make sure they're feeling okay? Am I um, excessively researching? Am I excessively decontaminating? Above and beyond, the hand washing for 30 seconds when I get home, right? Like that kind of stuff. Really identifying those behaviors, again, being a detective into yourself, into your own life. And, especially even if you don't have a therapist, I think being aware of what you're doing. And then again, like asking around, like, okay, do you do this? Like asking a friend that you trust who doesn't have OCD. Do you do this? Like be honest, right? And seeing if you can cut down on those types of behaviors little by little. And I think that can be a good place if you can't work with a therapist right now. Um, NoCD also has support groups that are free. So it's not therapy, right? It's not like necessarily a full replacement for therapy, but I think it can help, until you're able to go to a therapist or, until you can do that. And there's also like some like kind of self-help OCD books. I know Jonathan Grayson wrote one called Overcoming Obsessive Compulsive Disorder. Actually, I have it right here. Or Freedom from Obsessive Compulsive Disorder. And so it's just this one. Um, yeah, I'm not getting paid to advertise that. I just think it's a great book. And it's written for people with OCD. So it's kind of like if you can't get to a therapist or in addition to working with a therapist. So hopefully you can kind of guide yourself through that. Okay. Okay, so let's see. Um, do, 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 do. Okay. So my OCD is really bad the last few days. My OCD is really bad the last few days. My thoughts have I will have to go back to the mental hospital. I have been hospitalized a lot. It is a big fear. What should I do? Okay. Um, I'm sorry that your thoughts have been really bad. Like OCD is really loud right now. I think just recognizing that right now, like OCD is telling you that you have to do a ton of things, that a bunch of really bad things are happening right now or will happen if you don't do certain things. And really just having that ability to name what's happening can be a really good place to start. Um, and right, really examining, okay, like, am I doing anything differently because I'm afraid? If so, what can I do instead? Right? Am I engaging in a lot of compulsions right now because I'm afraid I might have to go to the hospital? Am I not doing things that I want to be doing or that I need to be doing because I'm afraid? Really recommitting yourself, like taking that action to doing those types of things rather than doing rituals, I think is a good first place to start. Um, and obviously, if you're working with a therapist, right, reaching out and working with them to come up with maybe doing some more ERP around that fear. Whenever those symptoms kind of spike up, right? I always say start with ritual prevention, and then do some exposures with that too. Um, okay, let's see. Um, what do I do um, when I can't tell what the obsession is versus the ritual? Um, yeah, okay. So this is common a lot for people with like obsessional, pure O, for example, or people who have mostly mental compulsions. I always ask yourself, what's the function, right? Like if I'm working with somebody and they don't know, I always ask, okay, like when you're in that thought process, right? When you're thinking, what are the thoughts? And what is the purpose behind that? Is there an end goal that you're trying to reach? And I think that could be helpful, right? When you're trying to figure out what is what, right? Especially if they kind of resemble each other, right? Like thinking kind of looks like thinking, right? Thoughts look a lot like thinking. So hopefully that helps. Um, okay, let's see. Back to ROCD. All right, so it seems that it is statistically unlikely that everyone with ROCD would be with a partner who they should stay with forever. How would you know if it's ROCD versus you should go? Good question. This is a really common, like, form of OCD, right? I think it's like the whole idea of like, I don't know if I really love this person or if that's my OCD. Um, I want to be careful with answering this because I don't think that there is like an easy way to figure it out. I've certainly worked with people with ROCD who have separated from their partners. I think if you feel like there's an urgency to leave, right? If there's an urgency to know if they're the right one or if this is going to work out or if, you're in the right relationship, whatever OCD tells you to do, I always say just do the opposite, right? If OCD is like you need to break up right now, right? See what happens if you can delay it a little bit. Um, if all else, like aside from OCD, kind of is fine, right? Then I think it's kind of worth delaying, um, separating, putting that off as much as possible. Um, I think I'm going to take this from like something that somebody I work with who has panic and agoraphobia told me once. If OCD is telling me I should stay, or if OCD is telling me I need to go, that's when I should stay. If OCD doesn't really care, right, then I can go, right? And I think that's a really good way to think about it. Um, okay, let's see. We are almost out of time, so this is great. Okay. Sorry for asking so many questions. No worries. That's what this is for. So, all right. Can compulsions be small things such as darting eyes, picking nails, etc.? Yeah. Compulsions can be anything, really. I mean, I think like if it serves that function of preventing, neutralizing, um, taking away any sort of distress, then yeah, it could be a compulsion. Um, even like anything can really turn into that, even things that are really subtle. So I think like I think that's good insight for you, like if you notice when you're doing ERP, like, oh, I notice like I whenever I do ERP and I'm like shaking my leg, it's like a little bit easier, right? Or if I'm rubbing my fingers together as I do that exposure, it's a little bit easier. That's good insight, right? Because anything could be a safety behavior. And so that's just kind of practice those detective skills. Okay. All right. A little bit more. I think I have contamination OCD, and lately it's been leading to anxiety attacks. Are there any coping mechanisms that I can try? Um, oh, I'm sorry you're dealing with anxiety attacks. Those are no fun. Um, I hope that, I think it could be difficult because they can feel so distressing. Um, I think when it comes to coping with contamination OCD, um, again, right, I think like the best way out is through, right? Like if you're dealing with contamination fears, like kind of facing those fears in gradual ways, whatever you can do today, to either whether it's kind of decreasing those rituals, taking those positive risks, um, to experience that feeling of contamination. That's going to be good, in the long run. In terms of coping mechanisms that you can try when you're experiencing high levels of anxiety, um, I don't want to necessarily encourage people to rely on like relaxation techniques or kind of like distress tolerance techniques. But I do think that there is value in knowing how to kind of keep going, right? Like things that can help you stay in it. And so this is where I think ACT is really helpful. There's a concept in ACT called dropping anchor. And I think being able to drop anchor, meaning like imagine that you're in a storm when you're really distressed, right? And you're a boat in a storm, right? Dropping anchor is like it's not saying no, there's no storm going on, that there's nothing going on, right? And it's also not you're not trying to run away from the storm, you're staying put, right? And so kind of dropping anchor by saying, okay, I am anxious right now. I am really freaking anxious right now. I am scared that I'm contaminated. I have high urges to wash my hands or, do whatever it is that you do. I'm feeling this, XYZ physical symptoms. I'm feeling really just terrified right now. Right. And so notice what I'm doing there, right? You're not necessarily doing anything to reassure yourself. You're just practicing present awareness and curiosity, right? Again, I know I mentioned that earlier, but being curious about what you're experiencing, being curious and willing, like I think curiosity is like that first step. Be curious about what you're experiencing. Okay, I'm feeling really dirty right now. I feel really contaminated. I feel like I just need to like shower away all my contamination. And I know I'm going to make the committed action to not do that. Right. And while I'm experiencing this anxiety, I'm going to just notice what I'm feeling, including, what else is going on around me. And that's kind of where you could use some grounding techniques, but not necessarily as a way to reassure yourself. So think of yourself as the boat, right? You're not running away from the storm. You're not trying to run towards higher ground. Right? You're not trying to tell yourself that there's no storm going on. You are staying put in the storm until the storm passes. So I hope that helps. It's such a fine line between relaxation, distress tolerance skills, and staying with it. Another kind of approach that sometimes I find helpful is like, and this was something that I like kind of talked to one of my first supervisors about when I started working with people with OCD. And it was the whole idea of like when you're in ERP, when you're in anxiety, when you're experiencing it, you're kind of like the boxer. You're a boxer in a ring, right? It's not like they fight 10 rounds straight. Right? Like they go and they have breaks, in between each round, and they return to their corner and they kind of take a few breaths. They take some water, they get that shiny stuff rubbed on their face, and then they go back in there. Right. And that's kind of what I think is going to be a helpful metaphor to remind yourself, right? You're not running away. You're not running out of the ring. You're not kind of waving the towel. Right. But you're also kind of taking a moment to say, I'm anxious. Right. I'm not going to do anything about it. So hopefully that helps. All right, I could do one more question here. How do you deal with your own reassurance? Are you not supposed to? I guess like in terms of self-reassurance, like it depends on like what it is that you're saying, right? I think like if you're saying something like you're trying to reassure yourself that your fears are never going to happen, or that if your fear is that you're a terrible person and you say, no, you're a good person, you're a good person, you're a good person, you would never do that. I think it could be, obviously that could be a really big compulsion. When it comes to reassurance of like, okay, right, this is difficult, right? It's okay, right? Like stay in it. You're going to be okay. Right. I think that can be a little bit more, that's not quite the same as saying, no, you're never going to do a terrible thing. Like your obsessions are totally never going to happen. Right. Again, never is a key word when you're trying to reassure yourself, like always re-inject that doubt. Right. I think like kind of leaving room for ambiguity is, OCD hates ambiguity. It wants black and white. And so recognizing that, reassurance can sometimes take that black and white or take that gray area away. And so we want to stay in the gray. Um, all right. Hey, Sarah. Thanks for joining. Anyway, so somebody just also asked about medication. Again, talk to your doctor about medication. Medication can certainly help. It helps a lot of people, and I also know a lot of people who haven't used medication and are fine. But I think it's different for everybody. So talk to your doctor. IOCDF.org has a ton of resources on medication if you want to check that out as well. But anyway, thank you guys for joining. This was fun. I'm happy. I'm really happy I was able to answer your questions, and I hope that you got some answers. And I hope you have a great rest of your day, evening, wherever you are in the world. And yeah, thanks for joining. All right, be well. Have a good one.